Prevent Blindness Focus on Eye Health podcast with host Christopher Hord and guest Ashley Mangen.
Today on our episode, we have a guest with us, Ashley Mangen. Ashley is a person who has dealt with cataracts in her vision journey and has had a success story with that, and is also a person who is active in being an advocate for blind and low vision community. Ashley, welcome to our program.
Thank you. Thank you for having me.
My pleasure. Now, please tell us a little bit more about yourself, a little bit about what you do, first of all.
Yeah, my career, I'm in banking. I started right out of college. And then I'm involved in several organizations, including the Prevent Blindness Ohio affiliate. I sit on the Miami Valley chapter board and the state board for Prevent Blindness.
All right. Thank you very much. Now, I understand that you have had a lifelong journey relating to eye conditions and especially relating to cataracts. Can you tell us a little bit more about that?
Yeah. So I was born blind because I was born with cataracts in both eyes. And they caught them super early comparatively because I was also born with a twin sister. So I had them removed at 1.5 months and 2 months old. They did each eye separately. And then later, when I was 13, as a result of that surgery, I got diagnosed with secondary glaucoma. Um, and then even later, in my early 20s, right before I got married, I regrew a cataract, which wasn't something I knew was possible until it happens. And then they took that one out. And then a few years later, or a few years ago, I had the lens implants put in for the first time. And so I can see the best I've seen in my 30s that I have my whole life.
Well, congratulations to you. Now, tell us a little bit about, as far as your journey went, was dealing with those vision issues, was that something that also you had to deal with as far as your youth and your development as you went to school and just sort of prepared to live day-to-day life?
I think the hardest part was the glasses I had to wear because when they took the cataracts out when I was a couple months old, they didn't put lenses back in my eyes. So the glasses I had to wear growing up were like super thick Coke bottle bifocals. So that made things hard because you could only see straight in front of you, but you could still see. When I switched over to contacts, that helped a lot, but it didn't really impact any of my development or education because I could see well enough to do all of that.
Okay, well, that's good. Now, you mentioned that you work with the Ohio affiliate of Prevent Blindness. Can you tell us a little bit more about your role there?
Right now, I'm the board chair for Miami Valley, so I help with a lot of the fundraising efforts. We just had our Person of Vision celebration, our annual fundraiser. Tony Hall was our speaker, and it was a great event. We had a lot of great support from our greater Dayton community. But then aside from that, I'm also a vision screener, so I go to different community events and I'll do vision screening for folks who maybe haven't had their eyes checked in at least a couple years, or maybe they don't have access to getting to an eye doctor. We try to get them screened and into our programs.
Okay. Now, what sort of places do you go to reach out to people to do the vision screening?
We work with primarily community health fairs. That's where we do most of our screenings at, but we'll also attend community events and set up tables. And sometimes we'll also receive direct referrals from partner organizations in the area that maybe have someone they've identified as potentially having a vision issue.
Okay, great. And are there any things coming up with the affiliate chapter that you'd like to make our listeners aware of, or how to contact or get in touch with the organization?
I think the best thing to do is to probably find us on Google. If you look up Prevent Blindness Ohio, it'll have a list of all of our resources. Prevent Blindness Ohio has a lot of specific access points for different resources within the state itself. I would say if you are not an Ohio resident, you probably would want to go to Prevent Blindness America for more accurate resources to your area.
Certainly, yeah. All right. And I guess outside of that, tell us a little bit about what you've learned in your journey, things that might be relevant to other people who are dealing with issues with cataracts, but also just people who are friends and allies who always, as we know, wonder kind of what our experiences are like. What can you tell them?
I think the most important thing is to go to the eye doctor on an annual basis. A lot of people think that cataracts and even glaucoma are diseases that happen when you're older. And obviously, I'm someone who's quite a bit younger who's experienced both of those eye diseases. And so I will say, too, in my experience, the earlier they're caught, the more treatable they are and the less impact they'll have on potentially limiting your ability to live independently and get around or have to make significant changes with your life.
That makes great sense. Are there any issues or concerns, things that you work with or work for that you would like to mention that we haven't touched on?
When when the cataract that I had in my left eye regrew, that one probably caused the most impact in making work difficult just because it was really hard to look at a computer screen for a good portion of the day until I had it removed. It almost whited out the screen or where like the bright lights were. And I had to advocate to have that removed because my glaucoma doctor at the time was really anti-surgery because he didn't want trauma to the eye because the glaucoma was so well controlled. And so I had to really push to get that done because my point was if I can't see with the eye anyway, what's the point of taking the eye drops? And I'm glad I made that push.
It's definitely very important to advocate for yourself and to be aware of your conditions when you're dealing with your healthcare professionals. Now, Ashley, I understand that you are a member of the Aspect program. Are you a current member, or when were you involved?
So I was in the most recent cohort that finished up at the end of the year.
Oh, okay, very good. And tell us a little bit about that. What did you learn, and what do you think you took away from that that'll help you going forward?
So I really appreciated the Aspect program. It was really insightful, and I think the most insightful part of that whole program was getting to hear all of the stories from everyone who was a part of it with you, and kind of getting to learn from their experiences and how they got involved in the Aspect program and how they advocate for either prevent blindness or for the blind and visually impaired community.
Okay. And based on your experiences, is this something that you would recommend to other members of the community, and people who are interested in advocacy?
Yes, I think it's a great program if especially if you're interested in learning how to advocate because they do structure the program in such a way that you learn how to tell your story and you learn how to make it impactful. And you also learn how to tailor it and maybe adjust it based on the audience that you're speaking to.
Yeah, I certainly noticed that you've gotten across your story in a very concise and clear manner.
Thank you.
Thank you for being a guest on the podcast, Ashley, and thank you for your great work with Prevent Blindness Ohio.
Thank you.
Thank you for tuning in to the Prevent Blindness Focus on Eye Health podcast. To learn more, please visit preventblindness.org.